Hello and welcome to part 3 of session 8 on Ayurvedic and Tibetan medicine. This is our last part for this lecture, and we'll start off talking about Ayurvedic diagnosis. I mentioned a little bit about the tongue in the last part, and we'll expand on that in this part. So in Ayurvedic diagnosis, the pulse is used as well as tongue, the state of the eyes, the nails, the face, the lips, and the urine, and that can be smell and or taste of urine. Which is obviously not something that we utilize in Western medicine. And we see a lot of these the diagnostic methods used across other whole medical systems as well. So Chinese medicine is a good comparator here. We'll talk a bit about some of these in more detail. And so Ayurvedic pulse diagnosis, similar to Chinese medicine, the pulse is taken on the radial artery, which is just here on the wrist. It's taken on both sides. And the overall pulse quality is noted. The Vata pulse will tend to be fast and slippery. A Pitta pulse will tend to be jumpy and sometimes feel kind of aggressive, like it's really pushing. And a Kapha pulse will tend to be slow and steady. And the pulse qualities are different at different positions on the wrist. And so 3 fingers are used on the pulse in order to take the pulse, again, similar to Chinese medicine, but the 2 systems are actually quite different in terms of the qualities that are looked for and what's ascribed to each pulse position. And at each position on the wrist, different information is given about a different dosha, so you can get lots of information. In the tongue diagnosis, cracks on the tongue and coating on the tongue, as well as the overall color of the tongue, is quite important. So the general appearance is looked at as well as color and coat, and the Vata tongues will tend to be dry, rough, and cracked. The tongue here in this picture is a Vata tongue. Pitta tongues will tend to be red with an oily or yellow coating on them, and Kapha tongues will tend to be swollen, puffy kind of tongues, light pink and moist with a greasy white coating on them. And you can get variations of all of these if there are multiple doshas out of balance. So sometimes the tongue can be quite complex actually to discern what diagnosis is going on, because oftentimes folks will have more than one dosha out of balance. Ayurvedic healing principles really proceed in the preventative realm and the healing realm in the same way, under the same type of philosophy. So we're always looking at wanting to engage in purification and rejuvenation, and that's true whether a person is basically healthy and we're instituting a lifestyle regimen to keep them healthy, so a preventative regimen, or whether a person is out of balance or overtly ill, we're also going to be using healing therapies that have the same function of purification and rejuvenation. And the level of those therapies or the assertiveness of those therapies are going to vary for a person who's well versus a person who is sick. They really proceed on the same philosophies. And the general principles that are used to achieve the purification and rejuvenation are proper diet, appropriate lifestyle and healthy habits, and by that we mean things like sleep and rest, balancing work and rest and those sorts of things, as well as not engaging in any major emotional upheavals, if at all possible, and those sorts of things. Exercise, and by that we don't necessarily mean the classical Western ideas of exercise of going running or lifting weights. We're talking about yogic versions of yogic types of exercise and other more gentle exercise, or sometimes more aggressive forms of exercise in people who need to burn off extra energy, as well as then administering a proper cleansing program. And like I said with regard to the purification and rejuvenation, the strength of a cleansing program is going to vary depending upon how toxic somebody is or how ill they might be. And if a person is really ill, then you have to go about it gently. But in order to really get to the end point that's being sought, oftentimes the cleansing will be aggressive. And we'll talk a bit more about that later in this part of the lecture. So we'll spend a while on this slide. This is a list of the healing practices that are used within Ayurvedic medicine. Diet, already mentioned. Herbal medicine's really a big key modality in Ayurveda. Yoga and meditation, lifestyle and behavior changes, medicated enemas, and by medicated we mean using the herbal medicines, but we'll talk more about the preparation of those and what they might contain. Massage with medicated oils, and again, those tend to be herbal-based medicated oils, aromatherapy, and color, gemstone, and sound therapy. So a few of these we're going to take up in a bit more detail on the coming slides, but I'll touch on a bit more detail on some of them here. So in general, the aim of all the treatments and healing practices is to purify the body, mind, and emotions to bring the doshas back into balance. So this is a theme we're hearing repeatedly here. And that will also be aimed at correcting any dysfunction in digestion and elimination. So if digestion and elimination are not working properly, one of the primary goals of treatment is to get the digestion and elimination working properly again. Because you can't have appropriate purification and rejuvenation without digesting your food well and eliminating toxins well. So all treatments are individualized to the person's constitution and the particular dosha or doshas that are out of balance when they present for treatment or consultation. With diet, the diet will be prescribed according to a person's constitution, but it will always involve clean, fresh food, chewing your food really well, and balancing the 6 tastes. And there are the 6 tastes are sweet, salty, sour, pungent, bitter, and astringent. And so a well-balanced diet is said to contain all of those different flavors in balance. And a food treatment that is aiming to bring something back into balance might call for taking a bit more of one or more of one of those flavors in order to bring things back into balance again. Because each taste has a different effect on the level of each dosha. And tastes can be varied with the seasons to deal with seasonal influences to help the body adjust to changes in the weather. And change of seasons is a classic time for doshas to get disturbed, particularly kapha dosha. You know, at the change of the seasons, we tend to come up with a cold more often, and that excess mucus that the body is trying to discharge in the disturbance of the change of the season is an imbalance of the kapha dosha primarily. We also have in the diet, I mentioned previously, certain food combinations that are considered to be not healthy. An example of this is having milk and bananas at the same meal. So that's proscribed. And there are lots of other of these food combinations that are to be avoided. And the commonly recommended diet in Ayurveda is a lacto-vegetarian diet, and that's in alignment with yogic principles. So lacto-vegetarian means essentially vegan with dairy, so no eggs and no other animal products except for honey is generally a big part of the diet as well. Herbal medicines will include in Ayurveda both animal and mineral or metal sources along with plants. So similar to other ancient forms of herbalism, we have things that we might not in the modern Western world consider to be herbs because they're not plants. The medicines are chosen according not only to what disease the person has, but what constitution or doshic imbalance they have. And these herbal preparations are very, very complex in the Ayurvedic system. They are prepared often by alchemical processes that involve incinerating the herbs, gleaning metals from plant substances, etc., as well as very complex formulations. So formulations that have a really large number of herbal or other animal or mineral medicines within them. So they're not simples. The timing and method of administration of these herbs is very important. So certain times of day are said to be better for administering certain herbal treatments, and that's also very individually determined. There are extensive texts of botanical formularies from the early centuries of the Common Era in Ayurvedic medicine. They have a very extensive materia medica. With medicated enemas, these are often, as I mentioned, herbal oils or decoctions, so they may or may not be oils, and they are used for absorption of the oil of the herbal constituents or animal or vegetable, animal or mineral constituents via the rectum, and so the goal is not with the enema is not necessarily a cleansing process, although it can be. It can be the administration of a herb, because we do get certain things that are absorbed better through the rectum and the colon than they would be absorbed if they came in through the mouth. Color therapies, so there are 7 bodily tissues that are defined in Ayurveda, and those correspond with 7 chakras and the 7 colors of the rainbow. And so colors are often used in therapy in order to encourage peace of mind and emotional harmony, and they have different influences upon the doshas. And so when we talk about color therapy, we're talking about bringing the colors in through the eyes, but also things like what colors of clothing we wear next to our skin can also have an influence. Gemstone therapy, part of that might be color therapy, because certainly the gemstones have different colors as well, but more has to do with energetic properties of the gemstones, wearing them as jewelry, or even placing a gemstone in water overnight on your bedside table and then drinking that water in the morning. So there might be certain elements that are conveyed from the gemstone into the water and to drink that water. And then sound therapy, using specific tones will aid in influencing the state of mind and the emotions, as well as physiological things like pulse rate. And so we see sound therapy across multiple different healing systems. We'll see this later in the semester with some others. Mantras in Ayurvedic medicine and yoga are the main form of sound therapy. And so producing certain sounds, not only the influence that sound might have on the ears, but there are also vibrations within particularly the head from chanting mantras, or within the thorax that create a vibration that has a healing effect as well. So with all of these treatments, all 5 senses are covered in the various treatments, and it's about balance. So we're getting taste, we're getting sight, we're getting sound, we're getting touch in massage, and they are all combined to create balance in the body. So it's a very holistic approach to therapy. So we'll look a little bit more at yoga and meditation, massage, and the lifestyle and behavior on the coming slides. So yoga and meditation, many of you are going to be quite familiar with these, or at least you've heard of them, certainly because they're very pervasive in the Western world now these days. Yoga, the technical term means to yoke or to unite, so bring something together. And so that means bringing us together with the source of our being, bringing ourselves into unity. This is an ancient Indian philosophy and a way of life meant to achieve complete harmony between body and mind. And we think of yoga in this day and age as being the physical practice of asanas or postures, but it is a much broader discipline than that. And there are different types of yoga. There is the yoga of service. There is the yoga of devotion. Or worship. And so it's not just a system of practicing postures or even practicing breathing or meditation. It's much, much more broad than that. In the realm, though, of Ayurvedic medicine, predominantly we're talking about yoga as exercise, and the meditative and breathing aspects of it, the breathing being called pranayama, being used to bring the body, mind, and spirit back into balance, because Ayurveda is about bringing everything back into balance. So the picture here is of a man practicing pranayama. It looks like alternative nostril breathing, which is something that is meant to balance the right and left side of the brain, as well as balancing the sympathetic and parasympathetic nervous system. That is bringing us back into balance between fight or flight, which is the sympathetic response of the nervous system, and parasympathetic, which is rest and digest, or rest, digest, and reproduce. Oftentimes that's cited. So yoga is a product of thousands of years of research. It is as old as Ayurveda. They developed in parallel or together synergistically. Thousands of years of research done by rishis in ancient India. And the aim of yoga as a totality is to live a healthy life and to attain enlightenment. That is obviously very much aligned with Ayurveda, and so you can see why they go hand in hand. And it's the main type of exercise that's prescribed in Ayurveda. The idea is that proper exercise in Ayurvedic terms should be pleasant to the practitioner as well as being beneficial to the body, the mind, and the spiritual life. And so we can compare this to some types of exercise that we might do in the modern Western world today. And we can question whether our exercise is pleasant to us and sometimes whether it's beneficial, if we're pushing ourselves too hard, if we are burning ourselves out in some ways by the types of aggressive exercise that we do, and whether our bodies are constitutionally designed for that type of aggressive exercise. Some of us are, some of us aren't. So yoga is a form of exercise that really facilitates smooth energy flow in the body, and it's primarily by focusing attention on the flow of energy in the body. And that focus of attention is accomplished primarily through focus on synchronizing one's movements with one's breathing. So certain movements are done on the in-breath, certain movements are done on the out-breath, and sometimes the breath is retained either in or out. So just a little bit more detail on the word asana, which is translated as postures within the exercise. An asana is a steady position of the body, and so most people will be familiar with what we mean when we say a yogic posture, and some of you are probably have practiced this yourself. But the literal meaning of asana is seat. And originally asanas served as a stable posture for prolonged meditation, as well as asanas having a particular purpose to prepare the body to sit in meditation. And so certainly once we have lubricated our joints and gotten some strength in certain muscles, stretching in certain muscles, we're going to have a more comfortable and meditative experience sitting for longer periods of time. So it's more than just stretching. It's about opening energy channels and psychic channels within the body, or centers within the body, working with the chakras and the way that energy moves in the body. So if our if the lifestyle we are engaging in is not providing natural motion of the muscles and joints, if we have a sedentary job, for example, then disease and discomfort are going to ensue over time in the body. And that's particularly true as we age. Certainly we have more wherewithal to withstand this as we are younger, and then as we get older, less and less so. So at the end of each session of asanas, we have a final posture called shavasana, which is corpse pose. And the practitioner is going to lie on their back and deeply relax. And it's interesting because we might not necessarily consider this part of exercise in the Western world, but through this deep relaxation, especially at the end of having exercised our muscles and joints, we get a thorough rejuvenation of the nervous system and get a sense of inner peace that we don't normally walk away from exercise with necessarily. And so there is this goal of getting to this place of peacefulness through exercise rather than necessarily just working the muscles or the joints. Breathing in Ayurveda or in yoga is termed pranayama. It is a method of controlling the prana, and we don't mean control in terms of this rigid sort of, but being mindful of the way the breath is used to help energy flow in the body, as well as being a point of focus for the mind. And proper breathing in pranayama is different depending upon what pranayamic exercise a person is doing. Sometimes the breath may be deeper and slower, sometimes it might be more rhythmical, etc. But the overall goal is increasing the vitality in different ways, as well as mental clarity through the focus on the breath. It also increases blood flow to the brain and stimulates the production of heat in the body. So any of you who ever have practiced different forms of pranayama, you'll be able to testify to or reflect on the fact that it does really raise the heat in the body. Some systems of pranayama differently than others. And again, here the image is of a man practicing alternative nostril breathing. And meditation we'll touch on here as well, because that is an aspect of yoga and is also used therapeutically in Ayurveda. Meditation is meant to be a focus or a concentration on one thing. That can be any variety of different things that we can focus on. That can be the breathing, that can be focusing on something visually, a yantra or oh, my words are failing me now. I've forgotten sorry, I've lost the word for that. You can focus on a flickering candle flame, for example. So there's different sort of visual things that can be focused on, as well as sensations on the surface or the inside of the body. So it's not necessarily about making the mind completely empty, but about focusing the concentration. Massage and the application of oils are a key therapeutic that's used in Ayurveda, and maybe one of the most commonly known therapeutics that are used in Ayurveda. And so I'll spend a little bit of time on this. So there are a very wide variety of styles and methods of massage under different names, as well as other methods, non-massage methods of applying medicated oils to the body. This, if it's a massage or a use of medicated oils, especially applied to certain parts of the body, the therapy is utilizing what are called marma points on the body. These are 107 points that have been defined on the surface of the body that have different therapeutic indications for massage and application of oils. And so whereas in Western massage and manual therapies, the emphasis is on the action of the hands as the therapeutic agent, in Ayurveda, the primary emphasis is on the use of the oils, and these are oftentimes specifically individually formulated herbal or medicinal oils that are applied to specific parts of the body in order to achieve their therapeutic effect. And in some techniques also, the use of the hands are very important for moving energy or smoothing out the blocked energy in the body. Traditionally in Ayurvedic massage, male patients are attended by male practitioners and females by females. And in a traditional setting, the massage is quite different than what we would expect in a Western setting. In a Western setting, we have more use of draping with towels or sheets, so that only the body part that is being massaged at any given time is actually exposed. This is very different in a traditional Ayurvedic massage, where the patient is laid out naked or mostly naked on a wooden table, and the oils are applied, and oftentimes the oils are actually recycled off of the table and back up onto the person's body. So there are actually channels on the sides of the table that the oil runs off and is brought back up onto the person's body. So we're talking about really copious amounts of oil, which is very different than what we see in conventional Western massage. And the nature of the therapeutic environment is also quite different. We see things like an Ayurvedic massage oftentimes being ended with a steam to the person's body, or with application of certain cleansing agents. A powdered chickpea flour made into a paste is used to remove oil from the body, because when you come away from one of these massages, you're copiously covered with oil. So a little bit more on the marma points. These are considered to be the Ayurvedic equivalent to acupuncture points in Chinese medicine. There are some that might argue that the marma points predate the Chinese medicine system, and they were the foundation from which the Chinese medicine points system grew out of. But that's really debatable in terms of which one developed first, or whether they developed in complete isolation from each other. So that certainly hasn't been settled anywhere. And the energy in the marma points is balanced through yoga and massage, as well as acupressure and the application of medicated oils to those points. So the image here on this slide is of an Ayurvedic treatment called Shirodhara, and that is the therapeutic applications of oils or other liquids such as milk in a steady and gentle stream to the patient's forehead. So you can see there's a cloth that's been rolled and placed across the patient's brow to prevent the oil from coming down into the eyes, but the oil is drizzled slowly onto the third eye, and it rolls back across the head and down off of the head. And this is a very relaxing and rejuvenative treatment. It also has a therapeutic effect for a wide variety of illnesses that affect the head, it's very, very common treatment. So lifestyle and behavior, again, a core therapeutic modality within Ayurveda, and we're talking about whether we are approaching Ayurveda from the perspective of treating illness or extreme imbalance, or whether we are just trying to maintain our health. And I say just, that makes it sound like it's not that important, but it is the core of Ayurveda, is that it's better to prevent imbalance and prevent or address imbalance quickly than to let it go out into an overt illness. And so there is this goal of harmony of body, mind, emotions, and spirit, harmony of the family and the community, and coherence of the consciousness. So this is very big, very holistic, expanding out into the family and community and all of the collective consciousness. It calls for daily and seasonal routines to bring life in tune with nature's rhythms, so daily habits that are undertaken every day, and that can be anything from yoga and meditation to cleaning the teeth properly, or utilizing a neti pot to clean the sinuses out, making sure your elimination is proceeding as it should, making sure you're drinking enough water, sleeping the same hours every day, and making sure that your sleep is for enough time. It also involves things like practicing human values on an individual level with their effects on society. So thinking about what your values are as a family or a community or an individual, and then making sure that your activities in your daily life are in alignment with those values. And that's a huge challenge, I think, for all of us. So being attentive to that and being aware of when your behavior might be going out of alignment with your values and bringing that back in, that takes a lot of mindfulness and self-awareness. And then routines and habits, some of those also might include prayer or worship or devotion that might be to a certain god or goddess or to a guru, application of the intellect, selfless service to your community, personal hygiene, which I've already mentioned, and then a general practice of restraint in behavior. And that has to do with appropriate social behavior, appropriate behavior within the family. Nonviolence would be an example of that. And then coming to one of the main ways that Ayurveda uses purification as a basis for then later rejuvenation of the body, we have the therapeutic modality of panchakarma. And panchakarma means the 5 actions. Karma is action, pancha is 5. And the 5 actions are those that are cleansing to the body, and these can be actually quite aggressive if we think about it in from a conventional Western framework. It is a normal part of Ayurvedic medicine within that tradition. So Panchakarma is an intensive cleansing and rejuvenation program that is undertaken generally over a period of a number of weeks or even a couple of months. It cleanses the body's deep tissues of toxins, so this is very intensive cleansing. It opens the subtle channels and allows more free movement of both healthy things and toxins to remove them from the body, as well as energy. It increases the life energy or the vital force, and it increases inner peace, confidence, and well-being. So for the most part, Panchakarma is really a physiological purification, or that's the main appearance of it from the outside, I suppose. And it probably is the best known Ayurvedic therapy worldwide in terms of sort of the big therapeutic approaches. It's systemic and it's quite rigorous. As I mentioned, it's really not for the faint of heart. And it has some similarities to humoral medicine in later European practice. So we'll see that in the coming weeks because it uses both purging and emesis. So purging is getting the bowels to flush out their contents. Emesis is encouraging vomiting. And so this is, from a Western perspective, this is not something that we consider that we would really want maybe to undertake therapeutically, but this has been something that is consistently used in traditional medicines and in historical European humoral medicine as well. Also within the system, using medicated enemas, both for cleansing and for delivering different herbal medicines or other types of medicines, a very strictly limited diet and intense bed rest. So staying pretty much in the bed, no exercise to be spoken of really for the entirety of the program. It is a program that will sap your energy because your body is very focused on detoxifying and removing things throughout the duration. And also use of detoxifying herbal medicines within the therapeutics. So a full course of this, and you're not meant to do part of it, it's meant to be done as a full course of treatment, as I said, over a period of weeks or even a couple of months. A full course of it is said to fully restore the constitutional balance of the doshas. So it's designed to mobilize toxins in the body and move them through the bloodstream to the gastrointestinal tract and then eliminate them from the gastrointestinal tract. And that's what I mentioned in terms of purging and emesis being used to get toxins out. The mucous membranes of the nose and the sinuses are contiguous with the mucous membranes of the gastrointestinal tract. And so the nose and the sinuses are also included in this sort of flushing of toxins within these methods of elimination that are used in this program. So the body is first prepared for 3 to 5 days using an oil massage and sweating to mobilize toxins and encourage the body to let them go. And then there are, after that, 5 different cleansing methods that are applied. A couple of those I've already mentioned, or a few of those I've already mentioned. And they also use treatments to purify the blood and clear toxins and mucus from the nasal and sinus areas. So if you've ever heard of a neti pot, and they can put different herbal preparations into a neti pot and use that to flush out the sinuses and the nasal membranes. During the treatment, lifestyle and diet are very strictly curtailed, and the emphasis is on keeping the body warm and out of the wind. So if you've ever engaged in a detoxification program before, you might have noted that you tend to get cold more easily, and that's because detoxification tends to drain heat out of the body. The more you are urinating or the looser your bowels are, and especially perhaps if you're also vomiting, that is taking heat out of the body. So keeping the body warm is very important, as well as resting and avoiding any new toxins coming in, no matter what form those take. So really avoiding emotional distress or mental stress. So not taxing the mind, not thinking too much while you're resting, perhaps staying off of Facebook or other ways that you might have lots of information coming in to your head, really avoiding those things and not taking any new stuff in during the treatment. Also avoiding any activities that will disperse the vital energy, such as, arguing with your partner, for example, or other things that would scatter your energy. And the intensity of this treatment is generally calling for it to be done in an inpatient setting. I have never seen it done properly in anything other than an inpatient setting, and that means you are sleeping in an Ayurvedic hospital for the duration of time that you're undertaking the treatment. And oftentimes in India, there are Ayurvedic hospitals that have Ayurvedic colleges associated with them or adjunct to them where the treatments are given. And so the students who are studying can learn from watching these treatments instituted over time and how people respond to them. If you are interested in learning more about Panchakarma, you can look it up. There's lots of reputable sources about this treatment program on the internet. So the later history of Ayurveda, it did spread to Tibet and much of Asia. It is a part of daily life in India, Nepal, Ladakh, and other countries that are close to the borders of India and China. The early foundational texts were destroyed by Muslim invaders in the 10th to 11th centuries of the Common Era, and major bodies of knowledge were lost through sacking and burning of university libraries. But enough was preserved in terms of the foundational texts that some of those texts are still used today, as I mentioned a couple of sessions ago. It did continue as folk medicine until 1835, and then it was declared by occupying Britain to be an unsanctioned system of medicine, and so it came out of use for some period of time, or at least it didn't come out of use, but it was attempted to be suppressed, I suppose is the way to put it. It has also later been challenged as a system by growing allopathic or homeopathic influences in India. And so we see Ayurveda as having spread out of India into neighboring areas. And this is very similar to the way that Greek medicine spread into Europe. And we'll see that in a few weeks. Not uncommon for something that is working in many ways to be replicated or spread to surrounding areas. And in some instances, the destruction of the university libraries left only Tibetan translations of the texts for much of ancient Ayurveda. So translations had been made into Tibet prior to the Muslims sacking the libraries and burning them. And so those then had to be translated back into Sanskrit for use by the Indian culture. In the present day, there are numerous non-allopathic forms of medicine that are mainstream in India, with 70% of the population utilizing one or more of those systems. And Ayurveda is officially recognized by the Indian government as a sanctioned medical system now. So that overcame the suppression that took place at the hands of the English occupation. Ayurveda is also now found in most Western countries, though practitioners are often practicing under a different regulated credential because generally there is not any regulation of Ayurveda. And so some medical doctors now practice Ayurveda as well as naturopaths or herbalists. Oftentimes also massage therapists will take on certain aspects of Ayurveda within their practice, but generally those are the hands-on approaches, and they might not involve things like individually formulated herbal medicinal oils. In Ayurvedic medicine, oftentimes mercury, lead, and arsenic contamination or purposeful inclusion are seen in Ayurvedic formulas. I mentioned that there are alchemical preparations of the combination herbal remedies that are used in Ayurvedic medicine, and the use of alchemical preparations oftentimes does utilize forms of mercury, lead, or arsenic, which we consider to be toxic, but in the preparation of these in the alchemical processes are considered to be non-toxic by Ayurvedic practitioners. This is a big bone of contention in the West and has caused some Ayurvedic medicines in the West to be banned from importation. And so consumers just need to be aware when purchasing remedies to make sure that there's some examination of that aspect of things. So the non-allopathic or non-conventional forms of medicine that are practiced in India at this day and age, including Ayurveda, are also homeopathy, yoga, Unani Tib, which we'll talk about in a few weeks, and naturopathy, which we'll also talk about later this semester. The revival of Ayurveda or the spread of Ayurveda in the West might be partly due to the Maharishi Mahesh Yogi, who developed transcendental meditation, which is a form of meditation that has been set up in the West. He has a university in Iowa, and that university teaches Ayurveda in the U.S. along with transcendental meditation. And it's a very well-funded organization that has had quite a bit of influence on the import of yoga and Ayurveda to the Western world. And he's also made the system much more accessible to the Western mind, and that has really helped to assemble fragments of that together that perhaps wouldn't be necessarily able to be assimilatable by the Western mind, because the philosophies oftentimes are very far outside of our frame of reference. So on to Tibetan medicine, and we'll just spend a few slides on this. It has a lot of similarity to Ayurvedic medicine and other systems that we'll study later in the semester as well. Ayurveda began to sift into Tibet around the 6th century of the Common Era, and it was related to the growth of Buddhist philosophy and practice at around that time. And the early 7th century Tibetan medicine became more formalized, and it was really at that point in time more of an amalgamation of Ayurveda, Chinese medicine, and Arabic medicine, which we'll call Unani Tib, which is actually Greco-Arabic medicine is a more proper way to reference that. The image here on this slide is that of the medicine Buddha. And so there is a specific manifestation of Buddha that is associated with medicine and the Tibetan form of medicine. Also within Tibetan medicine, we have local traditional healing philosophies and methods that have been or that were incorporated in, and this includes pre-Buddhist shamanism, which is, we've seen that term shamanism and we know what that means now. So we'll study Chinese medicine and Arabic medicine in the coming weeks, and we'll take up Tibetan medicine here because it does bear a closer relationship to Ayurvedic medicine than to the other two. So one example about how all of those medicines were amalgamated is in the use of urine quality to diagnose illness. So traditional Tibetan medicine uses urine quality to diagnose illness that comes from the Ayurvedic diagnostic framework to arrive at the elemental source of a disease. So Tibetan medicine doesn't use the doshas as much, it uses the elements, but it has transmuted the Ayurvedic system of urine diagnosis to application to the elements. The movement of information from Ayurveda to Tibetan medicine was not one way. So Tibetan culture was much more familiar with human anatomy and gross anatomy than Ayurvedic or Indian culture was, as well as physiology. And so, and a lot of this has to do with the burial practices that are used in Tibet. And so their knowledge that they had gained through dissection of the human body migrated into India and into the Ayurvedic system and really informed their understanding of the body tissues. So we have this exchange of ideas taking place in that geographic region. So to compare the two, both Tibetan medicine and Ayurveda will incorporate the concept of prana. But the cause of disease in Tibetan medicine, you might recall in Ayurvedic medicine, the source of illness is considered to be separation from the divine, and in Tibetan medicine is considered to be an imbalanced mental state. And so you see here the Buddhist influence or the Buddhist interweaving because Buddhism places a large emphasis on balance in the mind. And so you see that pervaded in the medicine as well. The 5 elements across the two systems are essentially the same, but the 3 humors or doshas are similar in concept, but they're named more according to Greco-Arabic medicine. So the names of the 3 humors in Tibetan medicine are air, bile, and phlegm. And so we'll see some of that same language when we get into Greco-Roman, Arabic, and later European medicine. Bile and phlegm are used significantly in those systems. And we also have the tastes of food being used to influence balance of the humors. But if you compare the Tibetan system with the Ayurvedic system, you might see that a food in one system is seen as having one influence, and in the other system is seen as having the opposite influence. So it's very interesting, and I'll give just an example of this. So, and sometimes same thing with the doshas, and the humors are quite different. So in an example of these differences, so Vata in Ayurveda is made up of air and space, and Vata is calmed down by heat. So if Vata is too large, it is calmed down by heat. In Tibetan medicine, the humor of air is actually aggravated by heat. So that's a difference, it's a contrast there. And then we have influence of foods that have similarities and differences. For example, in Ayurveda, sesame is considered to be warming, and thus it reduces vata because vata is calmed by warmth. Whereas in Tibetan medicine, sesame is seen as being cold, and it also is seen as curing diseases caused by air imbalance. So if you apply sesame to an air imbalance, it's getting better, even though the air imbalance is considered to be aggravated by heat. So it's an interesting point of contrast. And if you compare any elemental-based systems, you'll find these you'll find similarities and you'll find these differences that are relatively irreconcilable. So you have to kind of choose your art and stick with it. Also in Tibetan medicine, there's a sophisticated herbal pharmacy, and it drew very widely from different systems. So they drew from the Ayurvedic materia medica, but also from the Chinese and the Greco-Arabic. So they have one of the broadest systems of herbal pharmacy across all of the traditional medicines. They also incorporate animal and herbal or mineral or metal substances into their materia medica. So to contrast Tibetan and Chinese medicine, which we'll come to in our next lecture, and this is a good little segue into our next lecture, many therapeutics in Tibetan medicine come from Chinese medicine. So they utilize acupuncture and moxibustion, which is the burning of a specific herb. We'll talk about that next session. They utilize pulse and tongue diagnosis that has more similarity to Chinese medicine than to Ayurvedic medicine. They utilize cupping and bloodletting, and that in part relates to Chinese medicine as well as relating to Greco-Arabic medicine. And they have a system of medicinal postures and movements that is quite similar to Qigong. And we'll talk about Qigong in our Chinese medicine lecture as well. Then we also have traditional Tibetan shamanism, and that is a unique flavor within Tibetan medicine, or a unique modality within Tibetan medicine that is not shared with any of these other contributing contributing traditional medicines. So this is a pre-Buddhist shamanistic method of divination, healing, and spiritual practices, and it's a prescription of sacred mantras, movements, and internal visualizations of colors that are given to a patient by a healer, and that prescription is determined by a meditation that the healer engages in. So the Buddhist philosophy of reincarnation and karma are very strong influences here, but this is a pre-Buddhist influence that comes in as well. And so you get this sort of, within Tibetan medicine, you get this dual nature of the pre-Buddhist thought and the Buddhist influence as well. And so in the other shamanistic traditions that we've seen, we've got this connection to animal imagery in Tibetan shamanism as well. So the image here is a wind horse, and that is an allegory for the human soul in the shamanistic tradition of Tibet. And in Tibetan Buddhism, it was included as the pivotal element in the center of the four animals that symbolize the four cardinal directions within Tibetan Buddhism. And it's a symbol of the idea of our well-being or good fortune. And so we see in the shamanistic traditions this tie to animal spirits, and that certainly is true in this one as well. So we've come to the end of session 8, the end of part 3, and we have, as usual, our revision questions here, as well as those being listed on the LMS. The other food for thought question: what is an aspect of Ayurvedic and Tibetan healing philosophies that's been lost from modern conventional medicine? So think about what you know about modern medicine in the Western world and the medicine that you might know conventionally, and what aspect of Ayurvedic or Tibetan healing philosophies has been lost. And with that, I bid you adieu. Here are your references if you want to dive into any more of those, and we'll see you again in session 9. Take care.